Wellbeing as a KPI. One of the silver linings of COVID-19 has been staff well-being moving from a fringe concern for employers to becoming a focal point. Is it time for more workplaces to demonstrate their stated commitment to caring for their people by adopting a KPI based on staff well-being? Article by Thea O'Connor. With the new understanding that employee well-being is a critical factor influencing which organizations will survive our new uncertain normal, many companies around the world have made it their top concern. As workplaces reset their norms to adapt to different operating conditions created by the pandemic, now is the perfect time to bridge any gaps between rhetoric and reality. One way to do that is to adopt a well-being key performance indicator, a KPI, reported to the board and based on the mental and physical health of employees. A well-being KPI is a good idea that is picking up significant speed right now, says Wolf Kristen, co-founder of the Global Center for Healthy Workplaces. But we have a long way to go for this to become a mainstream practice, he says. Jeff Kennett, former Premier of Victoria and former chair of Beyond Blue, has long been a proponent of using such a measure to garner commitment from leaders, telling the Australian newspaper as far back as 2016, quote, that will focus their minds more than anything else, end quote. Leadership support is, indeed, critical to achieving staff well-being. When an organization's well-being strategy has strong leadership support, it is 4.2 times more likely to report significant improvement to employee health risks. Selecting what measures should form the basis of a well-being KPI can prove challenging. A workplace could attempt to measure employee well-being directly. Given that an individual's health and well-being are influenced by many factors, not just work, an organization may understandably balk at being held accountable for this. However, tracking trends in well-being over time could still provide useful insights that would make it easier for employers to care for staff when and where help is needed most. Advances in artificial intelligence, AI, and data analytics are making it much quicker and easier to collect information about employee well-being and generate insights. However, no matter how impressive the AI, workers still have to be willing to offer up their private thoughts and feelings. When the Data Analysis Bureau, a UK-based data science agency specializing in machine learning and AI solutions, was testing its recently released Mental Wellbeing Index for workplaces, it found that the biggest challenge was allaying workers' fears about privacy and how the data would be used. It was critical to reassure employees that the data collected was aggregated and anonymous, so the organization had no ability to identify individuals, says Eric Topham, the Data Analysis Bureau's co-founder and CEO. He says, when workers learned that the data was only accessible to a select number of people outside of line management, they were more receptive. The index developed by Topham's team measures employee mental health using a 5-question survey. Employees are asked to take the survey once a fortnight, using a stress and mental well-being app. Once per month, they are also asked to select an emoji that best represents how they feel at the time. This allows an organization to keep its finger on the pulse of how employees are faring and direct individual employees to relevant resources and support contacts according to their survey results. An alternative to measuring well-being itself is measuring workplace behaviors or job conditions known to influence employee well-being. The well-being behaviors of leaders is one possible focus. As research shows, they influence employees' health behaviors, participation in wellness initiatives, job satisfaction, stress levels, and safety, says Katrina Walton, founder and director of workplace consultancy Wellness Designs. When a leader takes a break for lunch or leaves work on time, for example, this not only supports their own well-being, but also sends a clear signal to their staff that these behaviors are not only acceptable, but also encouraged. Safe Work Australia has identified several other factors that affect the psychological well-being of employees, including control over your work, supportive relationships, rewards and recognition, and role clarity. A KPI built around these would help workplaces fulfill their obligation to create a psychologically safe workplace. Supportive relationships at work have proven to be an especially potent buffer against workplace stress. But how do you turn that into an actionable, quantifiable KPI? One way is to require managers to ask about health and well-being for each staff member when conducting a performance review. Providing guidance for managers on how to do this, through mental health training, for example, can help elevate any concerns by managers that they have to be a counselor before opening up the conversation. Given the complexities involved, it is not surprising that some organizations already using a well-being KPI are keeping it simple by basing it on participation rates. Monash University, winner of the 2016 Global Health Workplace Award, has been using a university-wide well-being KPI since 2009. It measures individual participation in a single well-being event over 12 months. The target had originally been set at 5% in order to get some easy runs on the board, then increased to at least 30% of staff each year. Program activities relate to physical activity, general health, mental health, and nutrition. Monash has achieved its target for the past 6 years. Reported at the highest levels of the university, all the way to the Chief Operating Officer and the Vice Chancellor, the KPI has proven very valuable in raising the profile of staff well-being, according to Dr. Vicky Ashton, Monash University's Chief Medical Officer and Occupational Health Physician. Ashton says it's helped create the cultural shift we wanted from the outset, that of strengthening the importance of health and well-being in the workplace of our staff. The university's well-being KPI is also reported to the facilities and divisions each quarter. If the well-being KPI is low in a certain area, we approach that area and ask what they need and how we can best support them. We actively seek staff feedback and are looking to include other measures such as opportunities for staff to come together. Walton has also seen participation rates used as a well-being KPI in some of her former in-house well-being roles. Quote, in one instance, the well-being KPI was linked to salary bonuses for senior leaders and middle managers, according to the participation rates of both themselves individually and their teams. How leaders and managers were supporting the health and wellness of their team also formed part of their performance review discussion. Another KPI Walton had used involved a target for managers to offer their staff one department-based well-being initiative each quarter. Walton says, we helped ensure that the initiatives offered were based on staff need, and we gave the managers resources and a budget to help them succeed. Successful adoption of a well-being KPI takes work. Walton says, it took a lot of advocacy and relationship building to help ensure it was well received. Communicating the benefits to help create high-performing teams was key. Whether well-being KPIs can achieve their true purpose for caring for staff will depend on how they are framed, explained, executed, and supported. If they are owned by employees at all levels, they have the potential to be powerful enablers of creating workplace cultures that truly care.